Okay, good morning. Thank you everyone for joining. We're just gonna take a second as folks come into the room. We're welcome to our monthly webinar series on strengthening social connectedness. Our February series is a focus on strengthening social connectedness among older adults. And I am just going to give it just one more second, but we plan to be here for about an hour. We have three amazing speakers doing some really great work in this area, and you'll see our tone for the webinar is to be conversational, build connections, and build a community. I'm Danielle Varda. I am the CEO and founder at Visible Network Labs, and I'm also a professor at the School of Public Affairs at the University of Colorado, Denver. And it's my pleasure to welcome today our three speakers, Jainine Vanderburg, who is the director and chief catalyst at Changing the Narrative, Bob Murphy, the Colorado State Director of AARP in Colorado, and Morgan McDonald, the Community Resource Navigator at the Center for African American Health. And we're going to get to know a little bit more about them in just a minute, but I'm going to start with just giving a little bit of background on Visible Network Labs and why we do this webinar series, and to let you know that there's a whole bunch of others coming up. We decided at Visible Network Labs to spend this year focusing our webinar series on social connectedness. And we are fortunate to work with people all over the country doing this work and all over the world. So take a look at this. And if there's other areas that you're interested in, please note them. But if you also are doing work in this area, we want you to reach out to us and let us know so that you can participate, maybe be a speaker. But we're just really looking to build a community around this work. And so it's really important for us that you reach out and let us know. As we're getting started, we encourage everyone to put your name and what you do and why you're here into the chat. So go ahead and take a minute to do that. And let's see, and we just want to highlight next month's webinar on understanding social connectedness among young people. We have the great privilege to work with the Annie Casey Foundation, and we run a fellowship, a youth fellowship on social connectedness. So our fellows who've been working with us for almost a year are going to be presenting. So on this webinar, you'll see young people who are studying and learning about social connectedness share what they've learned. So it'll be a really special webinar for that reason. So we hope that you'll join us. Just a minute, I wanted to let you know who Visible Network Labs is. I'm real proud of our organization. We have a mission to make invisible networks visible. We know that we're all embedded in social connections. They matter to our health and well-being outcomes, but they're pretty much invisible to ourselves and the people who are trying to help us and care for us. So it's our goal to use data and science and technology to make those visible, whether it be for an organization trying to partner with others, or your social worker or clinician who is trying to help think about whether you have the right amount of care. So that's our goal, and we are a social enterprise who are dedicating our time to this. And our vision is that we have a world where social support, everyone has the social support that they need. We have this phenomenal team that does this work, so I like to kind of show them off. I always say we all roll out of bed in the morning so that we can tackle social isolation, connectedness. This is what we're doing together. And it's this kind of amazing team that does this work. One last thing about what we're up to, we use network science as this unique lens on social connectedness. If you want to learn more about that, you can watch the January webinar. But what we realize is that social connectedness looks different. We think about adverse social connectedness not just as social isolation, but also as the way people could be connected to a lot of others that maybe they are highly dependent on but can't trust to help them when they need it. So social connectedness comes in lots of shapes and forms, but we know that it happens at the individual level, kind of at the community level, and there's even policy and different kinds of programs levels that are addressing this issue. So we really try to look at a full view of social connectedness. So you'll hear this come up in our webinar series. Sometimes we're talking about individuals, and sometimes we're talking about big systems and the way they address this. We do that work personally at Visible Network Labs using our partner platform and Partner Me. And if you want to learn more about how to use these kinds of tools to measure and track and visualize these networks, again, you might want to listen to the first webinar series from January, where we just kind of show that and go into depth on the philosophy behind this work and how we try to conceptualize social connectedness from a strengths-based perspective and a way that we're trying to build actually new connections for folks while leveraging the connections that they already have. Last thing about the series, we also have a time when people get to all come together. This year, we're doing an in-person series again in October, and the Network Innovation Summit will run October 17th to 18th. And this is our replacement right now of the Network Leadership Training Academy, our NLTA. And this is a day that we get to really think about the future of networks and where we are, and especially the impact that COVID has had on both building and causing challenges for networks. So put this on your calendar if you're interested, and come join a bunch of people who want to think about networks, geek out on that together. All right, so what I'm going to do is a section now we call Visible Us. It's really important to myself and the folks that usually come to these webinars that we get to spend a minute really getting to know each other. So I like to do a little Menti poll. So if you have your phone, you can just get the QR code for this. If you don't, you can go to menti.com and put in the code 44783571. I'll leave it up for a minute. And we just have a question today that we hope folks in the audience can answer. And it's really just what do you think of when you think about social connectedness in older adults? This is our chance to kind of hear from you and get a sense of where you're thinking about this work and the kinds of things that come to mind. So what I'm going to do is go on over to the presentation. And as soon as, there we go.
Number back for a minute here.
You bet. Let me put it in the chat, or if someone from my team could. Sorry, I'm going to have to come. Let me, whoops. Here's the info. Okay, let me get it into the chat. There we go. Okay, so that should be there. And let me get back to this. Okay, so excellent. So we've done this a few times during our webinar series, and it's a great time to get to hear some feedback from you all. So we asked about social connectedness in older adults, so we can see what's kind of popping up, what's on people's minds today. So loneliness, isolation are kind of sitting there with a lot of mentions, but opportunity, caring is also support popping up. Ageism, love, belonging, a shrinking network. Excellent. Well, go ahead and keep populating this. We are collecting these over the year to really try to see like what kind of language and word that people use when they're thinking about these kinds of issues. So I'm going to ask our speakers just real quick. Do you have any reaction to this? Is this what you expected to see from our audience?
I'm glad to see that ageism is up there, because that's what I'm planning to talk about. So
excellent.
Yeah, I'm also glad to see opportunities. So there's a positive approach as well.
Yeah.
Cool. Okay. All right, well, don't feel like you have to stop sharing on that, because we really will. What we'll do is what I'm about to do here, which is just revisit last month. We asked people a couple of things. One, we said, who are you? Like who's on the call? And we gave the question said, like, what's your job, family, adjective, hobby. And it was really wonderful to get to see that. We didn't do that here today, but we just saw so many fun things. Like I learned about the nudibranch lover. Afterwards, we just dug into this to see like, what is that? And what does this mean? So we're going to keep sharing these. This is the community of people who are joining this call and these calls. You can see they come from all over. They are all kinds of have interest in all kinds of different things. We also asked last time, what are 3 to 5 words that come to mind when you're thinking about social connectedness? So generally, these were the kinds of words. So real interesting. There was a real kind of different set of words that we saw today when we thought about social connectedness in older adults. So we're going to just continue this work. Thanks for sharing. Kind of helps us see who's here. So I'm going to just spend a minute before we get started what in our part we call visible us. And oops, these are not the right questions that we're asking today. So what I'm going to do is just go back to our presenters' pictures, but we have some questions for our presenters that we want them to answer, and you can answer one or any of these, but I'll start with Jainine. So Jainine, what I'm hoping is you can talk a little bit about yourself. So we call this like the people behind the projects. You're going to hear a lot about the work that all 3 of these people are doing. And this is our chance to get to know, they're pretty special people who have come to this work in really interesting ways, the pathways. And it's really, we think, important that we get to highlight the stories and people behind all of these projects. So how did you come to the work you're doing today? Was there a person or experience or story that influenced that? And is there something you're most proud of? So you can answer one or all 3 of those, and I'll start with Jainine.
Danielle, thanks. So I'm going to start with a story, and it's less that it influenced my work, but it's something that has garnered my philosophy of life for a really long time, that, you know, human potential has no expiration date, if you will. So my mother grew up in an immigrant family that sent the boys to college, but not the girls. And my mom was really smart, graduated from high school at 16, had a family, did all the things. When she was 60, she went and looked at my dad and said, "Ray, I'm going to college." And he was like, "Okay." And literally at age 60, she enrolled in college, graduated 4 years later, magna cum laude. And I realized when I was there on her graduation that in growing up with my mom, I had never, ever seen her so happy as the day she collected that diploma. And it was a powerful story for me about how, you know, at any age that we should never be giving up on people. How I came to this work, I led a social sector consulting firm for years, worked a lot on early childhood issues, women's issues, social justice issues, all of it around the same idea, right? That we can't let human potential go to waste. And as I was exiting, trying to figure out what my encore was going to be, or what the equivalent was going to be of me going to my husband and saying, "Oh, and now I'm doing this." Teresa Ellery from Rose Community Foundation called me in 2018 and said, "We and Next 50 Initiative want to run a reframing aging anti-ageism initiative in Colorado, and we want you to head it up." And I said, "That sounds like a really big job." And I'm thinking 20 hours a week and beach and that kind of thing. And well, here I am like 5 years later. So, or 4 years later. What I'm most proud of the work that we are doing at Changing the Narrative is the number of people that we've involved. So many people want to, and older people want to be engaged in community, want to be engaged in work and that kind of thing. And too often we allow ageism to get in the way, which reduces, you know, one, it's bad in and of itself, and we'll talk more about that, but it reduces our ability to be connected to others. So I'm proud of, last year, we reached over 6,000 people across. We started in Colorado, but we're now kind of national, if you will, in all 50 states of the US and 24 countries outside. So that's the reach of where this is going, and people wanting to get involved in this is what I'm most proud of.
Awesome. Okay, great. Well, we're going to hear much more about that. But I'm going to move to Bob. So Bob, this is our getting to know you moment. So tell us a little bit about how you got here and why you do the work you do, anything you're proud of.
Sure, thank you, and welcome everyone. My name is Bob Murphy. I'm the State Director for AARP Colorado. We are a nonpartisan, nonprofit organization with 38 million members, age 50 plus nationwide, and 670,000 of those members here in Colorado. I oversee our advocacy and outreach and coordinate all of our efforts here in the state, and we don't have enough time to talk about that everything AARP does. I came to this work through public service. I spent 22 years at the city of Lakewood as first a planning commissioner, a city councilor, and then mayor, and then joined AARP in 2016 as the state director. I was just thinking, listening, as I was thinking how I was to answer this question, it's kind of ironic when we talk about social connectedness, because on any Myers-Briggs test I've ever taken, I'm not just an introvert, I'm like way off in that corner of introverts. Yet my predecessor as mayor used to call me the reluctant extrovert when I was a public servant. So obviously I enjoy the ability to connect with people. It's a great part of what we do at AARP. And I think the thing I'm most proud of is the way our staff and our volunteer team throughout Colorado come together to do this work. And I do want to acknowledge Jeremiah Moore, who's on this call. He manages our outreach. And just to give you an example of what we do, last year, he put together about 150 webinars and engaged, as we call, over 35,000 people on a variety of topics. Some obvious ones, like we want to let people learn about COVID and then vaccines and how to keep healthy and all that sort of thing. We also like to do what we call fun with purpose events with our members. So one quick example, yesterday, we do tours. Yesterday's tour was of Casa Bonita, a place you might have heard of in my former town of Lakewood. And we had 700 people on this webinar to learn about Casa Bonita. So wow. It's not all just high intellect, it's giving our members a fun experience as well.
Yeah. Well, great. And Bob, one thing I think you just pointed out is social connectedness does not always have to mean you have to be an extrovert and connect with lots of other people. There's just so many different ways that connection's right for each person. But I love the way you described yourself. I actually really relate to that. Okay, Morgan, we're going to move to you. And questions, tell us about you, where you came from, what you're proud of, any stories.
Awesome. Thank you so much, Danielle. I really appreciate this opportunity. But my name is Morgan McDonald. I'm the Community Resource Navigator at the Center for African American Health. And I've been in this position for about almost a year. And so before this position, I was a fourth grade teacher. And so that experience alone makes me feel really comfortable with facilitating the programs that I have and, creating curriculum and really creating a space for the older adults to come to and really share. And so before this position, I actually lived in Houston, Texas, where I worked at the MD Anderson Cancer Hospital, the pediatric unit. And that experience alone really told me that I was really passionate about giving back to people and really helping others and creating a difference. And so I'm really just happy to be able to wake up every morning to do a job that I love. I always feel like the programs and the participants that I have is like family. And so my job feels really close-knit and exciting to do every day. So that is something I'm really proud of with the way the programs have been. So I'm excited to let you all know more about the programming, but with the Center for African American Health, we have a lot of services and a lot of different supports that we give to the community members. And so I'm really just grateful for this opportunity.
Awesome. Okay, well, thank you all three for sharing a little bit about yourself. I just want to point out how hard it is for us to talk about ourselves, right? Almost all of you talked about your work in the same breath. It shows your passion, but also, I'm going to click out of this real quick and get back. But it's just really amazing. Really I think the selflessness that we see from people doing this work. So okay, we're going to get right into our content. Thank you all for helping us build this community and being here today. What I'm going to do, this is just a slide full of words, but I don't think I have to go through with folks on the call why this is an important topic. So I just went in and used the AARP work and some of the national surveys that has been done to point out the connection between social isolation and the prevalence of that's happening with our older adults. And how that's increased during COVID. So you'll see some statistics there. 2/3 of adults are suffering from social isolation, lacking companionship and feeling isolated. And I think that has increased across our planet a little bit during, COVID. But the connection between social connectedness and health is also something that I think we've heard a lot about, how social isolation can increase risk of dementia, increased risk of stroke, and things like that. So I'm not going to go too much in depth on this because I have a feeling most of us are pretty familiar with that on the call. And I think what our panel here is going to be able to do is talk about the connection between social connectedness and other outcomes, but also what we're doing about it and why there is opportunity, and why we're figuring out ways that we can solve this problem together as a community. So I'm going to switch to Jainine, and I could read her bio, but what I'm really just going to say is I got the opportunity to meet Jainine many years ago when I was just starting my own new career, and she's just a force in the community, a leader, and I've had the privilege to continue to work with her in one of my classes where she hosts our students and works with them on projects. So Jainine has done some pretty amazing work, but I'm going to let her talk about it. So Jainine, this is what we're going to do for the panelists is each one is going to have some slides and present about their work. And then we're going to have a short discussion before we move to the next person. So we'll start with Jainine, and I'll hand it over.
Danielle, thank you. So I had an initiative that is called Changing the Narrative. And essentially what it is an initiative to change the way that people think, talk, and act about aging and ageism. Now, part of you may be thinking, and Danielle, I'm just going to keep going. Next slide, I know. Part of you may be thinking, what on earth does this have to do with social connection, right? Because we work more on the systems and kind of policy level. But I want to put forth this idea and encourage you to think about it. To what extent does ageism contribute to social isolation among older adults and actually younger adults as well? And in what way does it really interfere with social connection? So we define ageism, we use the World Health Organization definition. It's prejudice, it's stereotyping and discrimination based on age. And I always think it's important to acknowledge that ageism isn't just directed against older people. When younger people are told, oh, you don't have enough experience or are discounted, that's also ageism, right? So I want everyone to think about, if we think about going upstream, right? We know that both during the pandemic, all the studies showed that the two groups that experienced the most social isolation were both older adults, but also much younger adults, right? Disconnected. And to what extent does ageism get in the way? Next slide. So I want to offer just a few examples of how ageism can lead to social isolation. So the one thing we know for older adults is ageism pushes people out of the workforce. So AARP has done a bunch of studies on this. Urban Institute did a study that was released a few years ago that showed 56% of people entering their 50s pushed out or laid off because of age. Only 10% ever recouped financially. So when you're pushed out of a place where many of us have that social connection, right, that contributes to social isolation. We also know that when you're older and pushed out, much harder to get back in. Ageism, attitudes, and I don't think this is deliberate. People don't say, let's go ahead and isolate young people here and let's isolate old people here, but it kind of happens, right? I often wonder, even when I think about a concept that is well established in our society of a senior center, I call that institutional age segregation. Why do we think that all of a sudden, and I'm 68, is there a reason why I would want to go someplace where everybody else is my age, or am I more interested in being involved with people who, like I am, are politically involved, who, like Danielle, care about networks, who, like, many of you have these other different interests? Is there a reason why we don't organize people kind of by interest, but somehow suggest that, older people ought to live together, older people ought to play together, et cetera? And then I think this really came out during the pandemic. And Danielle, I know this is a later question, but ageism, and it was implicit bias. It wasn't deliberate, like, oh, let's isolate those older people. But think of the public policy decisions that were made. So for example, in Colorado, a decision made early on, we're going to continue with child protective services and have people check in with children who are at risk, but we're not going going to continue with adult protective services and check in on older people who are at risk. We make decisions again with well-intentioned that we are going to, if you're in skilled nursing facility, long-term care, et cetera, we're not going to let anybody visit you. All of those kind of public policy decisions kind of reflect implicit bias that we have, but that lead to social isolation and led to some of those staggering numbers that you showed at the beginning. Let's go to the next slide. So what does the changing the narrative do about it? So we believe that we have to go upstream, that we have to have some very concrete solutions. And I know you're going to hear from both of our other panelists about very concrete things that can decrease social isolation and increase social connection. And we also think that we need to go upstream and really think about sources of ageism and go ahead and address those head on. A popular saying of ours, we borrow from civil rights leader Grace Lee Boggs, who said, "We are the leaders we've been waiting for." In other words, let's not wait for another organization. We've got to figure it out ourselves. And for changing the narrative, that kind of plays out in two ways. One, it's in the type of work we do, and I'll share a few slides, but it's also in the way we do our work. The way we do our work is basically with what I call civilians. We call them change agents at changing the narrative, but basically volunteers who are primarily older adults. And we increase the social connection among older adults by getting them together and fighting some of the root causes of ageism and ageist philosophies. Next slide. So some of the things we do workshops on reframing aging. We know that our society is very ageist, and so we kind of teach and share information about research-based ways to talk about older people and about language and messaging that are more effective. Next slide. We do a lot of community education and organizing. Now, it was lovely when we were able to do this in person before the pandemic, because obviously that in itself brought social connection when people could come together and talk about what does ageism in the workplace look like? What does ageism in healthcare look like? We trained older people, and we continue to do that virtually now through a virtual speakers bureau. So we are basically bringing together older people around issues of ageism and having we're developing, if you will, our own solutions and putting them out there in the universe through community education and organizing. Next slide. We do a lot of storytelling and challenging stereotypes. So one of the things that we know about social isolation in older adults is very often, if you're experiencing it, you feel like it's just you, that you as the individual or your mom, your dad, your grandparent is the only person experiencing that. So one of the things that we like to do is challenge the stereotype about, oh, here's the older person just sitting in their home, looking out the window, looking sad, hoping a cat walks by, and instead tell stories of real people, real older people who are every day involved in our community with the idea of inspiring people to think about what they can do better. So for example, today on our social media, you'll see a lot of posting about, a woman who needs no introduction in dance history, Cleo Parker Robinson. And we're doing that not only around here are the kind of things that you can do at any age and how you can get involved. Next slide. A very specific intervention that we created. Remember what I said earlier, social isolation and lack of social connection isn't just older people. So thrilled, Danielle, that you're doing this program in March and in April about younger generation. A powerful intervention is to actually bring generations together instead of living in these little age segregated silos that our society tends to organize in. So we have a program that called On the Same Page. It initially was in 2018 and 2019. We did these in person. We brought older people and younger people together to have conversations about topics that matter. We moved that virtually in 2020, and anybody can go down or to our website, basically download a toolkit, and which has questions, sample things so that people can talk across generations. So we've had this was so much fun in person. I find the experience is not as great virtually, but we're working on it. We're working on it. Next slide. Policy research and advocacy. So one of the things that we discovered during the pandemic, I know this is a later question, but during the pandemic, we discovered that ageism was baked in so many public policies, and those public policies actually reduce social connection and isolation. So a lot of what we do, and again, we have volunteers, older people who are volunteers doing the research, talking to legislators, doing the advocacy in their own communities about how can we make sure that policies are less ageist. Next slide. We're going to go through these three just real quick. To reduce workplace age discrimination, which we know is a huge factor in causing long-term social isolation, we've got an age-friendly workplace initiative campaign. We talk to employers, we talk to anybody who will listen about the benefits of older workers and intergenerational teams. Next slide. We also do an age-friendly healthcare campaign. So a fun campaign that we're doing right now, we created with the Boulder County Area Agency on Aging, a 16-minute film. Anybody can basically download the film. You can show it in your house with friends. You can show it virtually, and then have a conversation about how you're experiencing ageism in healthcare. And so this film, the link to this film has now been downloaded time and time again. And we're also training older people to be able to facilitate this conversation in their own networks, faith communities, and that kind of thing. Again, both addressing root cause with older people, increasing social connection. Next slide. And finally, we'd like to do what we call popular public awareness campaigns that deal with ageism and popular culture. So we did a real photo contest to counter visual ageism that we often see. Last year, we launched a anti-ageist birthday card. And we, so basically, to counter the narrative that all of aging is all downhill. And then we, from time to time, coordinate social media campaigns. And this is something that we've had a lot of older adults weigh in. So again, countering the narrative that older people aren't on social media, et cetera, coming in and they're sharing kind of positive messages about getting older, about effective programs like AARPs and like Center for African American Health, and sharing fun memes and that kind of thing. So that's a little bit of what we do. I've probably gone too long. I will stop. Thanks, Danielle.
Thank you, Jainine. And we're going to queue up Morgan next. But before we do that, you answered the question I really wanted to ask, which was a little bit about how things have changed or the impact of COVID. But one thing I'm wondering is, as we think about programs and as we think about solutions, how do we keep people involved? How do we get the voice of, it sounds like intergenerational ideas around how to solve problems? What's your recommendation?
So to me, it's kind of community organizing 101, or I like to borrow this phrase from the disability rights movement, right? Nothing for us without us. I always worry when a group of people who have kind of no connection to older people say, well, this is what I think we ought to do, right? Without, and I'll give you a recent example. There is a commission that is being formed in Colorado. And it's the legislation that it's part of is doing all the right things. But the legislation says of this commission, which will have, some 20-something people on it, at least 2 must be older adults. This is for an older adult commission. And so I would challenge all of us to think, if this was a women's commission, if it was a Latino commission, would we think, oh, at least 2 women should be on the women's commission, at least 2 Latinos ought to be on the Latino commission? We'd say that's ridiculous. So I think all of us need to think about, when we're planning anything, who's at the table? Are there older adult representatives? Is there intergenerational representation? It also doesn't work if simply older adults sit around and say, oh, here's going to be our intergenerational program, right? Because then younger people aren't interested. So how do we co-create, or as my friends at encore.org like to say, how do we co-generate, right, programs and not create it ourselves in isolation? That to me is what's going to lead to effective things. It was dramatically missing during the pandemic, where decisions were being made by people who are not affected for people who were.
Yeah. Thank you for sharing that. I'm gonna go on to our next speaker. But if you all have questions, or I see some great ideas and some claps for some of the things being said in the chat, but go ahead and put questions there, and we're going to get back to this, so you'll have a chance to discuss some of these things with Jainine. So thank you, Jainine, so much. You can see I've learned so much from you. So every time I hear from you, and I appreciate that so much. There's a couple of, oh, I should have put, this is Janine's contact, but we'll share our slides after, so don't feel like you have to scribble this down right now. So I'm going to move on to Morgan McDonald. So Morgan, I'm going to move over to your slides and let you talk through them. So welcome, and here we go.
Awesome, thank you so much. So I facilitate all of the senior programs at the center. We have 4 total programs that we use for the senior wellness conversations that we do have. And so you can go to the next slide. I'll just start with the first program. So the first program I have is the Journey to Wellness program. All of our programs are virtual. So with the pandemic and like everyone else, we've really had to learn how to pivot. And a lot of our programs and the curriculum has been designed to be in person. And so we had to get really creative about how do we make these programs still be engaging, still have people who want to come and learn and get this information, and how is it going to look if it's going to be virtual. So with the Journey to Wellness program, this is a program for people who are diabetic or pre-diabetic, and it is to really just reduce your risk for future health problems. One of the main things about this program that it is a year-long commitment for participants. We encourage the participants who sign up to stick through the whole year, but we get it, it is a big commitment. And so we like to have everyone come on and be able to share what they are going through in their experience and what they are kind of looking for. So we do like to tailor each program and each group for what that group needs. And so in this particular program, we talk about ways to become physically active, how to just overcome barriers, and really finding motivation for change. So we promote a lot of healthy eating, a lot of healthy cooking. We do some cooking lessons, some cooking demonstrations with a chef who comes from our advisory committee, who I will talk about in a second. But with the Journey to Wellness, we are in partnership with Tri-County Health Department. And so I facilitate this classes along with Teresa Smith, who is a great person. She wears many hats. She actually is our nutritionist, our dietitian. So we do lean on her for a lot of the information. And like I said, this is a virtual class. So the one thing that the Journey to Wellness looks different with these other programs is that it really allows the participants to build more of a bond and a stronger bond because they're together for the full year. So one of the perks about this class is being able to be in partnership with the Denver Art Museum. And so the Denver Art Museum provides us art at hand box. And so we're able to do some activities with the participants with the Denver Art Museum, and to also include community engagement. So my next program is the Aging Mastery Program. This is really geared towards the adults who are 50 and up. So the older adults who are 50 and up are coming to this program who are looking to build a playbook to aging well. And so what does that mean? It just really means, how do you want to age? What do you want to do to make you age well or to help you age well? So we do lean on that advisory committee, who includes doctors, pharmacists, nurses, dietitians. We also have some who come in and do some yoga with us, do some chair yoga, and these are all virtual. So it's really easy for us to get some people to come in and navigate these conversations with us. One of the main topics in this program is the advanced planning conversation. And when we talk about advanced planning, it's really just getting end of life details in order before end of life. And that is something that has been really popular in this program because we provide a 5 wishes document, which you're able to get notarized, and you're able to really set how it is you want to leave your finances and everything else. And so Dr. Scott does come in. He works with CU Anschwitz, and he comes and he speaks to us and navigates this conversation. And all of the participants really love him. All the older adults, they like to go have coffee with him after and just really to get more information. So it's really an amazing program. And we also use the National Council on Aging's curriculum. So they give us a nice big core curriculum workbook where we are able to just dive into some of the information. So again, the topics that we talk about is the exercise, financial fitness, healthy relationships, and medication management, and the community engagement. So we are together for 10 sessions, and again, this is virtual. So I will go to the next slide. So these two are my focus on either diabetes or hypertension. So for those who are having diabetes or having issues with type 2 diabetes and just wanting to control it better, this is a great program. We provide a lot of incentives that are hands-on, a lot of incentives that are you're able to work through without even being in session. So that means we're giving out water bottles, we're giving out fitness trackers, we're giving out medication management items and things like that, so that everything that we give is something that we're going to talk about in our program. So we do have Teresa Smith with Tri-County who checks A1C levels, and we really do dive into what you need as a participant and what you're looking for. So like I said, we do like to make sure each cohort, they're getting specifically what they need, because each group and each participant is different. With the hypertension program, this is actually one of my favorite programs because we actually do a lot of hands-on activities. And so in this program, they're actually able to receive a free blood pressure monitor. And in that, they're going to take their blood pressure recordings at least every week that we meet. So we'll meet for 8 sessions. And so when they take their blood pressures, we also lean on that advisory committee for them to come in and help navigate those conversations, topics like healthy eating, healthy cooking, physical activity, medication management, and more. With the healthy eating and healthy cooking, one of the highlights to this program is that we have a chef, Layla, who comes in, or excuse me, her name is Chef Layla. She comes in and does a part 1 series with us. And part 1 will include menu planning, going over a grocery store tour, and kind of how to go grocery shopping and to shop from the outside before you go through the inside. And she gives them a lot of great tools. We talk about, of course, salt is one of the main topics when we talk about hypertension. And so she gives us some alternatives and some other resources that we can use when we're cooking. That second session, she comes back and we do a cooking demonstration together as a group. So participants and the older adults are able to follow along. So she'll create baskets and everything that we'll need the week before to get participants ready to cook with her. And so her camera will follow her around in her kitchen, and we're able to cook with her from the comfort of our own homes. And so that has been something that has been really engaging and has really allowed participants to keep coming back. And so we are really excited about that program. This is, for all of these programs, they're all something that we offer to anyone, but I do have on that last program, if you don't mind going back to that last slide, I'm just going to refer to the Aging Mastery program. That is the one that I have for seniors and for older adults. So if you're 50 and up, you're more than welcome. And I think that the beautiful thing about these programs is the connections that are being built, the way that they all lean on each other. They're coming to these programs and really being vulnerable with one another. They're sharing their experience, they're sharing kind of their concerns and what their fears and things like that. And so when you are on a weekly call and you're talking about the same goals and the same objectives, then it really does allow for a more a better camaraderie when we're meeting. And also just a safe space, to have that safe space to go. And so we did find that during the pandemic is something that really everyone may have needed, but social isolation did come into effect quite hard on the older adults. And I think we found that to be important. And so to really take the time to listen to what the participants are looking for when they come to these programs, what they need, because as I said, the curriculum is built to be a person. And so we want to really focus on our older adults because they are at higher risk. So taking these programs and making them virtual is really about the care of our community, the care of our older adults, and making sure that they are still engaged and that they are still able to do these programs, and to really make sure we're thinking about what incentives and what information and education that we provide to them and what is most helpful to them. So I spoke a lot about what I do in the programs, but if you have any questions, please let me know. These are ongoing programs. We do cohorts, so they are we'll do our sessions, 8 sessions to 10 sessions, and then take 2 weeks off and gear up for the next session. So these are ongoing for the full year.
Awesome. Thank you so much, Morgan. I'm going to go ahead and jump over to Bob so we can save time for questions at the end. But I just wanted to say, when I met Morgan and we were talking about this, and I said that you must be such a joy for people who come to these programs and get to interact with you and learn from you. And she said, she told me people refer to her as like it's Christmas, like getting a gift all the time. And you're such a gift to the program. So thanks for sharing them with us. It's really awesome. And if you have time to get to know Morgan better after this, you should contact her because she has so much experience and a wealth of resources for people.
Thank you, Danielle.
I'm going to go ahead and switch over to Bob and let him talk a little bit about the work that he's doing with AARP. So queue up your questions, and after Bob's done, we'll spend a little time talking.
Thank you, Danielle, and 2 great presentations. Thank you both very much. I couldn't help but think that we're sitting here talking about social connectedness, and we're doing so in a virtual environment, right? And we at AARP were fortunate, in large part to Jeremiah, who I mentioned earlier, who was way ahead of his time. We were prepared to immediately transfer all of our in-person programming to virtual programming. And we've seen through that process kind of a fascinating evolution where, first of all, we were providing a lifeline of information for people via virtual environments, information about COVID, about vaccines, about keeping yourself healthy, brain health, that sort of thing. And then over time, remember, we're talking 2 years now, we sense this sort of virtual fatigue setting in. And I think we all understand that. And now, as we all contemplate going back to in-person events, as wonderfully highlighted by this photo here, we're seeing the pendulum start to go back a little bit, in that there is some reticence out there about attending these mass events again. So what we see going forward is kind of a hybrid. People are used to this virtual environment. They're going to continue to want that content, but at the same time, they're going to look to do what these 2 lovely ladies are doing in this photo and interact on an in-person basis. So I just have 4 quick slides. If we can switch to the next one. So I'm going to talk about the healthcare impacts of social isolation, and indeed, on the next slide, talk about life expectancy implications of it. So AARP does a lot of research, and we have found that the negative impacts of social isolation health-wise can be equivalent to smoking 15 cigarettes a day. We show that Medicare pays an additional $6.7 billion annually in taxpayer money to deal with healthcare outcomes from social isolation. And you can see how that compares to other things like arthritis, high blood pressure, heart disease, diabetes. Those numbers aren't that important, but the important thing to me is it punctuates the fact that we're even having this conversation about negative health impacts along with diabetes and heart disease, right? This is a very serious societal healthcare matter when we talk about social isolation. Next slide, please. So I'm going to go down a little different path here, in part because this study just came out yesterday. Maybe I just liked writing 2/22/22, but it did in fact come out yesterday. I thought this was really fascinating. We do a lot of studies at AARP. This one has to do with equity of life expectancy, which I think needs to be a part of this conversation. And then the economics of the inequities, if that makes any sense. So the report, this is called the disparities in life expectancy. It has the disparities will contribute 1.6 trillion in annual economic costs to the GDP, 10.1 million lost jobs, 1.1 trillion loss in consumer spending. And if you're represent a local government like I did, you know how important sales tax revenue is to providing services. But most importantly is the human cost here. The disparities in life expectancy, and I'm talking about amongst people of different racial and ethnic backgrounds. You can see that's 6 years lost for an African-American man, but the overall impact on all of us of this inequity is 4 years loss in life expectancy. And 92% of the people we're talking about are in the age 50 plus cohort. So if we're able to equalize these racial disparities, there'd be an average of 3.7 additional years of life expectancy for all of us. And that would be 6.6 additional years for an African-American male. A lot of statistics, but we like to view things through the equity lens, and this is just one example of that. Next slide, please. So what does AARP do about social connectedness? We have our priorities, we call them enterprise, AARP Enterprise, but we have 8 or 9 or 10 priorities that we focus on, and you can see how many of them really go back to social connectedness. Digital literacy, we've talked about that. Senior Planet is now an affiliate organization of AARP, training people in the use of technological equipment. Broadband access, so you can utilize that equipment. And by the way, equitable, there's that word again. It's not just about reaching rural people, it's about reaching about equitable access in urban areas as well. Making sure people have financial security through encouraging retirement savings, Social Security, et cetera. Making sure people can afford healthcare so they can live a little bit longer and in a healthy lifestyle. Long-term services and supports, a big focus of ours, making sure that people can stay in their homes and in their communities as long as possible. It's healthier for the mind and body. It also is healthier for taxpayer dollars. Family caregiving. There are 48 million family caregivers in the United States, over 600,000 here in Colorado. We place a lot of emphasis on that. And I just want to do a quick shout out here. We are nonpartisan, but yesterday was National Thank a Caregiver Day. I knew that because Senator Michael Bennet, who has long been a champion of character, sent out a tweet thanking family caregivers yesterday. So he's long been a champion for that in Congress. Obviously, affordable housing, we want to make sure people can live with dignity and a roof over their heads. And then age-friendly communities, ensuring social connectedness through that. Next slide, please. Speaking of age-friendly communities, this is a long-time effort we have. We have over 600 in the United States. We provide people a structure of 8 domains of livability. And you can see that between social participation, social inclusion, civic participation, how many communication information, half of these are directly related to the connectedness that we're talking about right now. Last slide, if there is one. There isn't one. Great. All right. Thanks very much.
I'm so sorry, Bob. I'm not sure if we've missed one in there.
Oh no, that was my fault.
Okay.
You didn't.
Well, and I have to apologize. I'm trying to look at the chat, and every time I do that, it's making me move the slides back and forth. So I need to become better at this. But thank you for your time prepping all of these. I want to open it up for any questions that folks have to put in the chat, since we just have a few minutes, and I want to make sure you have access to Jainine, Bob, and Morgan if you have questions. So go ahead and put them in there. I'll try not to advance the slides as we do that. But I have a question for I think all of you as we wait to see if there's any. But the how are you getting people engaged? So we have people at home, let's say during COVID, who need help, and we have different access to internet and resources and things like that. So what are you doing to help people know about these programs and get engaged with them? How do you outreach? And anyone can answer that.
I'll say for the Center for African American Health, we do have an outreach committee. So we do have a team that goes out to our community and provides flyers and information and resources about kind of what we're doing at the center. And so those include my program flyers. And so we'll push those and also use social media. I've also been in contact with a few of the partners who share their program flyers with their networks. And so really just making sure we're connected with other people to kind of help push those programs, and also going into churches. So we are we have a faith health group that we also lean on as well. So going into churches to talk about our programs and services, and really anywhere we can reach anyone.
Nice. Oh, go ahead.
I was going to say a very similar strategy. Before the pandemic, I mean, we were all of our programming was in person, and we were doing a lot of workshops with actually organizations serving older adults and on reframing aging, on ageism, et cetera. So our first thing when we had to move everything virtual was reaching back out to those organizations who themselves had their way of doing outreach directly to older adults in their community. So that was kind of a way. And then there's a multiplier effect, right? Because of programs like of Senior Planet and others, more and more people, more and more older people gradually did gain access to technology, into the internet, although we still have a long way to go during the pandemic. So the more do, and the more people participate in programs like Center for African American Health and AARP, the word just keeps spreading, and people feel more comfortable doing it.
I just add, anybody who happens to be a member of AARP knows there's no shortage of outreach from us. We do. That was meant to be a joke, but it's true.
Two of your emails this morning. Yeah.
We do know who and where our members are. Email is our most common method, but we do lots of other ways. We actually have 2 associate state directors for outreach. I've talked about Jeremiah, who does our community outreach. We had another gentleman by the name of Roberto Ray, who specializes in multicultural outreach. So there's really nothing more important to AARP than reaching our members.
Excellent. And one question here, what solutions and ideas excite you the most when it comes to addressing isolation and loneliness? This was I wanted to ask the question too, like, what's next for us? What's the future here that we need to, put our resources into?
So Danielle, I'll just speak up. I think what would be fascinating would be to have in April or in May, have the older adult group and the younger adult group come together, because I think the real promise is around intergenerational solutions for a lot of this. And you're doing both, and let's eliminate silos. Let's bring everybody together and figure it out together.
Okay, and Jainine, I need you to come and facilitate that, because you have figured out how to bring those conversations together, and I really appreciate that. That's amazing.
I think we're being in the early stages of conquering this digital divide is very exciting to me. Conquering it in an equitable manner, a word I keep using. But as we see more older adults with the ability to appreciate and use technology, up to and including telehealth, right? Take care of their doctor's appointments. And with a massive amount of federal funding involved now in building out broadband, I think that's one of the most exciting things for me.
Yeah. Excellent. Okay. There is one last question in there, but I think it connects to outcomes. I just wanted to finish up with asking, how do you know if your program is working? What are you doing to evaluate or look and measure outcomes?
So we do ongoing evaluation of everything we do. I mean, basically from the time, anything that we're designing, we're starting by thinking literally with the end in mind. What are we trying to do? To what extent does it do it? And then the other thing that we've really tried to capture is what we call the ripple effect. What are maybe unintended outcomes, both good and bad? And then when we see good unintended outcomes, how can we dive deeper into that?
Excellent.
As a mayor, I had 155,000 constituents who often let me know how I was doing, if you know what I mean.
Yeah.
I now have 670,000 members in Colorado, and they're not shy about letting us know either. And that's a really good thing. So we get plenty of opportunities for feedback.
And for us, we have program evaluation. So we have surveys that we also give out to participants after they've taken the programs to see just their feedback. And then one of the cool things about Journey to Wellness is there's actually a celebration after that full year where they come and share their journey to wellness and how their experience was. So they have to write something and kind of share their feedback. So that's also another way we kind of capture their experience. And also they're also not afraid to let me know what they want. You should try this for the next program. So they love to give me ideas, and we love to hear from them. And I also think just paying attention to how our numbers are raising in each program. So that tells you that word of mouth is working.
Awesome. So I heard getting feedback through stories and numbers, also having an agile mindset, which Jainine described, we learn and then change and shift. And that this is a vocal group that uses its voice. So thank you so much. We're just at the top of the hour. We will share everyone's contact information and the slides and any resources. So if you are involved in this work, we would love to hear from you also. So we're really trying to connect some dots here on who's doing this kind of thing, and just appreciate everyone being here today and caring about this topic. And we hope that you will stay connected and join us in future webinars as well. Thank you, Jainine and Bob and Morgan, for sharing your time and your expertise today. We really are grateful. I know you're very busy. So thanks everyone so much. And I hope you enjoy the rest of your week and that we will see you again and stay connected. Thank you.